Brain hemorrhage is a condition in which a blood vessel inside the brain bursts, which causes bleeding in the brain. Bleeding occurs either in the brain tissues or in the covering that protects the brain. The covering of the brain is called meninges, and this covering consists of 3 layers. This middle layer in these 3 layers is called arachnoid matter. This layer is highly vascular. That is, in this layer, a large amount of blood vessels are traveling, due to which sometimes the blood vessels present in this layer burst, due to which the blood starts to leak and accumulate in this layer. Whether the bleeding is in the brain tissues or in the arachnoid matter, both types of bleeding cause damage to the brain. If the bleeding is in the brain tissues, then in this case, the brain cells start dying due to lack of oxygen. And if the bleeding is in the covering of the brain, then in this case, the covering of the brain starts swelling due to the loss of blood, due to which there is pressure on the cells of the brain. And due to this pressure, the brain cells of this region start dying. There can be many causes of bleeding in the brain, such as a deep injury to the head, high blood pressure causing the brain to rupture, the presence of a tumor in the brain, or the patient having a bleeding disorder, etc. If we talk about the symptoms of brain hemorrhage, then as soon as a person has brain hemorrhage, he starts having severe headaches, and vomiting can also occur. In addition, the patient starts finding it difficult to see and speak, and the coordination of the body also starts to end. If all these symptoms are showing in a person, then it should be taken to the doctor immediately, because if there is any delay in the treatment of brain hemorrhage, then the patient may die. To treat brain hemorrhage, it is important to know in which part of the bleeding brain has happened, and how much part of the brain has been damaged. To check this, doctors do CT scan or MRI, and when doctors see which part of the bleeding is there and how much is there, then the treatment is started. In most of the cases, surgery is performed to remove the bleeding, in which a hole is made in the patient's skull, and the blood clot is drained. After treatment, if there are any physical abnormalities in the patient, such as walking and speaking, then physical and speech therapy is done to remove it, due to which the patient soon begins to perform his daily activities properly. Thanks for watching. Want to learn more about brain health? Subscribe now and hit the notification bell for new video updates.